Good afternoon, everyone. We will be starting soon. May I know if Dr. Ho, are you facing any technical difficulties?
Hello, can you all hear me?
Yes, doctor, we can hear you.
Yes. Yes, sir.
Well, I heard a lot of echo. It's strange. Huh? Do you hear echo?
From my side, it's fine.
What is the reason? Getting echo. Can you see the my PowerPoint?
Still clear, doctor.
The thing is that not only I can hear my own voice, when some of you talk, I can hear multiple echo. Is there anything I can do to rectify that?
Is it because you're using two devices?
No, because I use connection between my phone and the web, in order to access the WhatsApp. But after that, I unlink them already. However, despite already unlink the WhatsApp, I still hear the echo. Should I sign out and sign in again?
Okay, if it's fine by you.
Or other participants.
Maybe some of you can email me the link. It's better than I don't use the WhatsApp.
Okay, doctor. Good afternoon, everyone. We will be starting the session in a few minutes. In the meantime, please ensure that all your microphones are off throughout the session. Your cooperation is deeply appreciated.
Good afternoon. Can you all hear me? Hello.
After we can hear you.
Am I signing in with two account again?
This time it's just one account.
But I still hear the echo. Strange. me?
Yes,
Good. I
Doctor,
think there's
we
no
can
more
hear you.
echo already. Okay, thanks.
Okay.
All right, so sorry. So let's start now.
Can I start now?
Okay, sure. Okay, so today's topic, I'm talking about
How you see
something.
seeing himself?
Sorry. Sorry. Shall I start? Continue.
Doctor, can you hear me?
Yeah, I can hear you.
Okay, I'll just start off the session, yeah?
All right, sure. So good afternoon, everyone. So today my topic is about the various informations that we always been bombarded regarding heart, right? So we all know that the health of the heart is actually important. It matters, but we have been bombarded with so many informations where through friends or is it actually through facts and which one are fiction. So do a little bit of that second on that now. Okay, so why is it not fitting? Sorry, one moment. I think that thing a little bit. So you get your information. I mean, nowadays, is it from your next doors, the auntie there, from social media? Sometimes you get confused, right? Because of the various information that you get. So start off with one common maybe information that we get. Yeah? A 60-year-old auntie is having sudden onset stomach pain and nausea and had history of gastric before. Now, if she's telling you about this information, should you buy some gastric medicines now for her or advise her to see a doctor? Okay. Know that in a heart attack, I think probably you've attended a lot of talks now, you should know what is the common presentation in heart attack, right? So people can get most commonly chest pain, which is in the middle of the chest, and there may be nausea and vomiting and sweating, and also lightheadedness, palpitation. But unfortunately, sometimes get heart attack can actually be confused with other kind of illnesses. For example, some people may actually feel epigastric or your stomach pain, upper part of your abdomen. Now, and that can be part of because the pain of the chest pain can actually go to that particular area. Now, to add more confusion, some people actually have what we call heartburn, okay, which is caused by stomach acid going up to your food passages. Going up to the food passage and cause some pain, burning pain usually, and irritations. So something that all these particular complaints, including gastritis, heartburn, can all present very similar to having a heart attack. So you have to be very careful. So best advice for the patient to advise to be seen by the doctor immediately, especially someone who are elderly or having risk for heart diseases. So let's not make diagnosis ourselves and don't take it very lightly. If you have major discomfort, you should go and see a doctor. Okay, the second, we have a diabetic person, your diabetic uncle, maybe next door neighbor, looks pale and weak. He feels that there's some chest tightness but doesn't have any pain. Is it possible to feel heart attack? Is it possible in this scenario? So the answer is actually, I'm not going to review the answers, but there's something called silent heart attack actually, right? What it is? So now heart attack present typically, like what we are used to, meaning having chest pain or tightness, sweating and all that. So sometimes actually present with something that is so subtle that you won't think about having heart attack. You know? So they just present very weak, very exhausted, having some giddiness or low energy. It may be very mild chest discomfort, and you might actually miss it off as maybe you're just tired, you've been stressed out lately or something like that. So especially in diabetic patients, you know, so silent heart attack is something that can be a major problem because patient often attended to doctors late and the risk is very high now. Okay, so imagine if somebody doesn't look very well, having something, someone, especially we are talking about people who are already at high risk of heart problem, meaning people who are having diabetes, high cholesterol, elderly people, maybe high blood pressure or having high cholesterol. Okay, always get them to see a doctor immediately. Yeah? So there are also scenarios that when we thought we can get also very worried. Okay, I know I'm getting all of you key out and worried already because sometimes it doesn't look like a heart attack, but it's actually a heart attack. We have a scenario in which this scenario is like you're sitting at the kitchen table sipping coffee, then suddenly there's a chest pain striking you like a lightning bolt. It's sharp, it's sudden, it's stabbing. Then you press on your chest. When you press on it, it hurts. So are you having heart attack? Okay, which one? Is it very likely or less likely? So the answer is, okay, let's go through bit by bit. So there is something called costochondritis, or meaning inflammation of the joint of the ribs. So there are situations there is chest pain, of course, but the chest pain is more sharp and well localized in one area, and it's what we call reproducible. Means that you can actually get the pain, bring on the pain when you press on the area or that is inflamed. Okay, and the pain tend to be if you move that area, of course, and with activity and exertion, and also when you sneeze and when you cough, right? Again, when you are basically because you are moving that area, there's an inflamed joint around that. So if you have that, actually there's nothing to worry about. Okay, it's a good news. It's just a local inflammations on your joint of your ribs, and then some painkiller will actually solve the problem. From a real heart attack, sometimes for the layperson, you are still advisable to see a doctor as soon as possible. So just highlighting the complexities that sometimes it's not so easy to tell one from another. Okay, so it's not really a matter of chest pain, but you're feeling butterfly in your chest. Okay, maybe you can feel your heartbeat pulsating. And sometimes even the beat skips a little bit. This is something to worry about. What does it mean actually? Okay, is it a sign of heart attack? Or maybe it's nothing serious. Maybe you're just drinking too much coffee or you're thinking too much. So which one? Okay. So there are many causes for palpitation. This is what we call palpitation. And yeah, it's actually true that a lot of the palpitation is actually benign. Yeah, it could be because of stress, lately some anxiety, too much alcohol, taking too much coffee, and your cigarettes and all that. So, however, there are small instances in which the causation can be due to something more serious. Yeah, for example, heart problem such as what we call atrial fibrillations, in which your heartbeat is totally going to be irregular. Okay. However, there are sometimes the general conditions, being unwell. For example, you're not having enough blood in your body, anemia, or maybe some hormonal problems like thyroid disease can also cause palpitation. Whereas having skip beats, or what we call missed beats, are often caused by ventricular ectopics. Most of these are quite benign conditions. So not to be too alarmed. However, again, like I say, the same advice, if you're in doubt, especially if you experience some symptoms along with, let's say you feel not only palpitation, you have some chest tightness, pain, shortness of breath, you feel giddy, you definitely need to see a doctor to verify whether this is a benign cause or something more serious. So for healthy heart, you should avoid fats in the diet. Some people will be saying that, right? So is it true or not? Let's cut down on the fats. Then you'll be healthy. So actually not all are created equal. So there are some fats that are healthy. For example, olive oil. We all heard about that, right? Avocados and fatty fish like salmon. So those are actually rich. The salmons are rich in omega-3 and usually good for your heart. But there are fats that are not so good. Okay, like saturated fat. Okay, butter, meat, and milk sources of the fat. And the worst one that we want to avoid is trans fat, hydrogenated fat. They are usually are processed fat from vegetables, maybe, but they are processed. Okay. So next thing is, how about eating vegetables? Is it good for you? Would that lower your cholesterol level? Is it true? Or is it just a hype? Well, it's true, okay? So vegetables actually contains a lot of them. Most of the vegetables, they have fibers, they're rich in fibers, especially the components of soluble fiber. They can bind to the bad cholesterol and actually help to prevent too much absorption of the bad cholesterol. And so that's for it's actually lower your body cholesterol level. So it's good for your heart. So those are the food that actually showing this list. All the greens mainly, except for fatty fish like salmon, tuna, and olive oil. So those are also healthy. I think unfortunately in Malaysian diet we tend to this sort of food, have very little, taking in very little of this. Okay, what about statin? Is it something useful, or is it bad for you? I mean, we heard a lot in the circulating in the WhatsApp group and all that. You know how bad statin is a scam. Cholesterol is actually essential nutrient in your body is actually needed, right? So why are we taking statin, something that is artificial, the so-called, right, in order to lower your cholesterol when cholesterol is actually needed in your body? Why? In fact, a lot of people all know that cholesterol is actually manufactured in the body. So there's some argument that, hey, it's produced by the body because the body needs cholesterol, right? So why? So is statin really a scam? Okay. So controversial, like this topic. However, I'm going to say from medical point of view, there's some truth to it, but it's half truth. Yeah. So what actually happened is, okay, there are some people who champion a natural cause of natural way of lowering the cholesterol using red yeast. The red yeast rice is actually a traditional Chinese supplement also actually, that purportedly can help in lowering the cholesterol level. But how does it do that actually? So actually, this is something very curious, but actually red yeast rice contain statin. Okay, so whether it is actually a food supplement or it's actually a medication, so that also runs into control, especially in US where they're very strict. Anything that contains medicines actually need to be regulated by FDA. So when red yeast rice actually contains statin, so do you group it under nutritional supplement or food, or do you group it under medicine? So what is statin actually? Huh? A lot of people think statin is actually chemicals, right? And natural things, but it's actually derived from fungi. Okay, so it's actually natural. Yeah, originally it's actually natural source. Of course, you have unnatural, laboratory produced manufactured statin as well. But the original statin actually come from natural sources like fungi. Yeah? So why bother treating patients with high cholesterol, right? When you thinking that it's natural, but okay, not all cholesterol are the same. Let's understand what is the principle behind, right? The so-called LDL and HDL. LDL is the bad cholesterol, and HDL is a good cholesterol. So the LDL is where it's the one that's causing problem, right? Spotted all the cholesterol throughout our body, supply to the rest of the body, and whereas the HDL bring the cholesterol back to the liver. Okay, so when you have too much LDL, that's when you have build out of plaques in the blood vessels and causing obstruction to circulation, and the critical area will be the heart and probably the brain as well, the supply to the brain, causing stroke. Okay, so what the statin does is that it actually reduces, because we know that actually apart from food sources of cholesterol, a lot of portion of the cholesterol actually from own body matter in the liver. Statin actually reduces production of cholesterol from the liver. So my bottom. So my question is that actually, yes, the answer is statin is actually very important for people who have very high cholesterol or people who have high risk factors for heart diseases. And it's not true that all the statins are actually unnatural. Yeah. And as we mentioned that some of the statin actually derive from natural sources. Okay, so I think I'm having heart attack. Should I try cough CPR first before I look for help and all that? So can we cough our heart attack away? So there's been a lot of hype about that, yeah, talking about cough CPR. So is it real? So unfortunately, it is not. Okay, so that confusion comes from what is the purpose of CPR, and then what is heart attack, and what is cardiac arrest. Okay, so heart attack actually is CPR is actually for something situation which your heart stop beating, right? We call heart arrest. So when you have heart arrest, yes, does CPR will help, but see, the problem is that with a cough, although heart attack sometimes can lead to cardiac arrest, but this is not, right? Most of the time, heart attack, you are actually having your heart muscles actually dying off because of reduced blood supply to it and oxygen. But most of the time, it's still beating, right? When it's beating, then you will very fast, within seconds, to go to you will become unconscious. So if you become unconscious during cardiac arrest, it's not possible for you to cough. Okay, you cannot have a unconscious person still coughing, right? Unless you can manage to catch it just before you becoming unconscious. So this is very unlikely. So definitely is something very useful. Okay, it's only useful when you are getting unconscious, or in some other situation in which you have palpitations. Maybe you want to do a bit what we call Valsalva maneuver. So bottom line is, if you have heart attack, you should quickly get medical help. Yeah, go to hospital soon as you can. Yeah, call the ambulance. So if you care about your heart, you should not skip your dental appointment. Is it true or not? Is there any connection between dental care, dentistry, and heart attack and all that? Surprisingly, there is actually the link between health of your gums, especially, and the health of your heart. Okay, so what happened is that people with gum diseases, bad teeth, tartars and all that kind of thing, they are actually twice as high risk of getting heart diseases compared with people who doesn't have. So that is almost as high risk as people who actually diabetes or high cholesterol and all that. So is that so? That's because there is the bacteria, right, connections. So the bacteria from the mouth can enter your bloodstream through gum infections, gingivitis, especially the deeper one, the periodontitis. Then this bacteria can actually stick to the plaque that you probably already have in your blood vessels and contribute to more inflammations, and then cause more blockade of your blood vessels and leading to all kind of cardiovascular problem. So there's another thing is about ECG, right? So we all like to get ECG done, like routine check and all that, maybe once a year or maybe even more. So sometimes you get the report saying, hey, your ECG is normal, so you feel very happy about it. But should you be complacent about that? So ECG, yes, has its own place as well, in routine checkup and all that. But actually the resting ECG, which you do it stationary, just lie down, get the ECG done, is actually of limited value for screening for heart disease, actually. Because sometimes when you have a blockade in your blood vessels of your heart, and the early stages, you may not have symptoms, right? And when you're doing a resting ECG, you may not see anything abnormal about it. But that doesn't mean you don't have a heart disease. Sometimes when you want to really test it properly, you probably need to do a stress ECG or exercise ECG. So you put your heart under stress. Then you might actually detect the ECG changes that indicate there is a problem in your heart. Now, if there's a real problem from the stress ECG, sometimes doctor will proceed to a more invasive test, coronary angiogram, which is shown here. But sometimes some people want to predict, what's my risk of getting heart disease. There's nowadays got this calcium scan, right, which is available, which is quite sensitive now to look out for calcium deposits in the heart, which can be very accurate predictions for chances for you to get heart disease in the near future or far future. Okay, so if somebody is having erectile dysfunction, is there any correlation between that and heart disease? Should they be worried if they have erectile dysfunction and maybe they should also get their heart? Is that true? Actually, that is true. So there's a very strong link between erectile dysfunction and heart disease. So you might think, hey, how is it possible? Something so it's a different organs, but actually it's not that. The logic is not that off. Actually, it's quite logical because both of these are caused by the same risk factors. For example, people with diabetes, people with obesity, high cholesterol, smokers, high blood pressure who are not well controlled. This group of people will have problems with erectile dysfunction as well as having heart disease because they also affect blood vessels. Okay, so yeah, they are all connected. So therefore, if you actually take care of your heart, like having healthy diet, exercise, and other keep your blood sugar and cholesterol in check. Actually, not only help you in your longevity, help you with your heart. Actually, it will benefit your sex life as well. Okay. So what about people who have had heart attacks? Should they do any exercise or not, or exert themselves, or should just try to stay off and relax and be very conservative? Which one? Okay, so sometimes some people are actually very worried about doing exercise. Actually, if you are well controlled, okay, you are not having unstable angina. Actually, you are encouraged to go back to physical activity as soon as possible and maintain a very healthy lifestyle. Okay, so, but of course, to be on the safe side, you should, if you have had a heart attack, you should cooperate with your doctor, and the hospital in charge of your case, so that they will go to a program with you for what we call the cardiac rehabilitation. They gradually put you back to more and more physical activity, in a controlled manner, in a safe manner. So you can start with light exercises or physical activity, gradually increasing it, and stop when you feel a bit tired, or breathless, then gradually increasing all this physical activity. So it's not true that you should stay off physical activity thereafter, because that is going to actually, in the long term, cause more harm because you're not doing enough exercise, which is actually important for your overall health of your heart as well. So what about comparison between coronary bypass and angioplasty? Which one is better? So that also sometimes people are confused, right? So to answer this question, we first need to understand what are they. Coronary bypass, sometimes you get it from the artery or the veins. Essentially, they patch this graft into the segment of the blood vessels of your heart that is blocked. You bypass it so that the rest of the heart blood circulation. Okay, it depends on whether what kind of procedure, so it can last quite a long time. Whereas the angioplasty, using a stent, using a balloon to blow up the narrow area of your blood vessels, and then with a stent left there to keep the opening for a longer period of time. So which one is better is actually not a straightforward answer. Okay, it really depends. Yeah, for example, doctors will have to know how severe is your blockade and how many blood vessels are involved and which blood vessels. Okay, so some blood vessels, for example, the left anterior descending artery is actually very important, and this tend to be, if it's blocked, probably you need something more aggressive, right? Like angioplasty would be a good choice. If three vessels, this is three major blood vessels in your heart also blocked, probably bypass would be better, really, right? So if your blockade is only one or two blood vessels and doesn't involve the major one like left anterior descending artery, then maybe angioplasty will be good enough a choice. Now, Ben might that there is a risk in bypass also, because actually you need general anesthesia and there's bigger surgery. Okay, and obviously coming with general anesthesia and all that, the surgery and all that, the risk is higher. Okay, the next. So let's say after 5 p.m., okay, you had a long, hard day, and then finally it's time to go home. So you're so relieved, and then your boss is yelling at you, yeah, asking you to do OT. This is not the first time, let's say, and the boss excuses is always like, oh, don't complain about stress, it doesn't kill. Is it true or not? So I heard a lot of people who actually say, don't worry, just stress is just something that, a lot of people who doesn't take it very lightly. Stress is just something that you have to put up with, part of life and all that. Yeah, which is, in a way, yes, life definitely will have stress, but don't underestimate the effect indeed. Yeah. So long-term stress, especially, short-term stress that is manageable, no issues actually can be good for you. But long-term stress, where you are constantly particular state of being keyed up, and then your hormone cortisol is released into the bloodstream all the time, will actually have very serious health impact, including digestive problem, high blood pressure, and your heart disease risk will also go up. So I hope this is to wake up all of you regarding don't neglect your mental health. Yeah, not just about the food, the exercise that we talked about earlier, how to recognize our diseases, but do not forget that you have to take care of your mind as well if you want to live a healthy life. Okay, I think that's all. Any questions?
Hi, good afternoon, sir.
Hello.
Thank you, Dr. Ho, for that insightful talk about myths and facts about heart disease. There was a lot of confusion. I'm sure everyone was confused about all these myths and about heart disease. But I'm sure Dr. Ho has really enlightened us about this topic.
Yes, I totally agree with you, Darren. Not to deny, I even got some questions wrong during, Dr. Ho's question session. And with all the misinformation and the misconception out there, especially when we really need to understand the topic and so on, it can be hard for us to differentiate between myths and truth. But thank you to Dr. Ho, our speaker, and his amazing session. I believe that the public will be able to make the right choices when it comes to regarding their health.
Yeah, definitely, Sydney. Before we end this session, we will be opening the floor to the questions from Dr. Ho from the audience. So please feel free to drop down your questions in the chat box. So, doctor, the question is, may I know if we can prevent heart attacks with vitamins and supplements?
Okay, it really depends on what you mean by vitamins and supplements. So certainly if your risk factors, your certain risk factors, for example, high cholesterol, which can lead to heart diseases, if you supplement yourself with omega-3, that would be helpful to lower your cholesterol as well. Yeah? So yes, in a way, yes, it can help. But I believe we should not rely too much on supplements and vitamins. More important for us to keep our heart healthy and general well-being is to have a good lifestyle, include eating healthily. Okay, so sometimes taking vitamin supplement or even medication, sometimes it gives us a false sense of well-being, and then we thought, okay, since I'm taking supplement or taking medication, so I can eat anything that I want, So you go and continue to consume fast food and not doing exercise. Actually, at the end of the day, those things are more important than supplements alone.
Thank you very much, Doctor. The next question from Wahar. I read wrongly. Hi, Doctor. I want to know about the success rate of statins.
Statins or stents?
Stents. No, so it's actually stents.
Actually, to answer this question, you have to understand how do you decide first, right? So you mean how long it will keep the blood vessels open or patent, or
yes,
complications or anything like that? Yeah. What is the complications or things like that? So it's kind of like if you want the details, I think I'll leave it with the cardiothoracic surgeons who are conducting that all the time. But roughly, the stents cannot last as the bypass in general. Okay, so yeah, so occasionally you need to do again a balloon angioplasty second time. So, Kayla, you want exact numbers and figures? I think you should ask the expert in that. There's a procedure.
Thank you, Doctor, for answering that question. That's another question in the chat box. So this person asks, do heart attacks only happen in adults, or can children also have heart attacks?
Okay, very good question. So actually, of course, children can have this. These are rare. Okay, these are rare, and some people may have some predispositions. Yeah. For example, they have some genetic disorders, or they have autoimmune diseases. Their blood vessels, their blood, is more easy to clot. So under these unusual circumstances here, you can have children with heart attack as well. I see there is another question.
Thank you, Doctor. There will be a question by Ms. Mail. May I know when a person go through coronary artery bypass surgery, how long span left to live on an average? And does heart with liver failure, kidney failure, and perhaps lung disease? Why some insurance companies has a maximum RM cap on the angioplasty cost?
There's a lot of questions in one. Okay, let me see which one I can answer. Again, regarding the lifetime span, how long coronary artery bypass? You're using let's say you're using the arteria as a graph. Okay, generally you can last for the entire lifespan of the patient. Okay, the venous graph also can last quite a long time, but I don't have the figures, but basically it's quite a long 10 years, 15 years, no problem. Actually should be able to do that. Okay, does heart relates? What does it mean? Heart relates to liver? That question I actually don't understand. What does it mean? Heart relates with the liver? Do you know what the question means? Maybe I skipped that. And so the third question is, I do not know. Okay, the third question is insurance company, why they have a maximum cap. Probably you need to ask the insurance company.
Okay, thank you, Doctor. So that's another question. This person asks, I think females have more body fat content. So does it affect heart disease? Since fat correlates with heart disease.
Okay. Okay. This question is like to raise some sort of probably misunderstanding about body fat compositions and heart disease. Okay, so I mean they are correlated in a way, but not exactly. So we know that actually female have less risk of getting an attack compared with males, right? It's more to do with the blood vessels, the deposition of cholesterol on the blood vessels wall, what we call the plaque. So not so much as the body fat distribution overall. Okay, but of course, if you have obesity, right, you have more distribution, that indirectly will also affect your risk of getting heart diseases. So I guess female also, although they have more fat content, but they are protected indirectly by female hormone, okay, to protect them against the heart disease. So you don't look at one part, and you think that, oh, that is bad for you. Because anyway, being male or female, you can't do anything. It's not a matter of choice.
Thank you, doctor. There's one more question. I think I have heard attacks usually occur on Monday morning, as in a higher risk of heart attacks. Is this myth true?
Well, actually, I haven't heard about that. Huh? Monday morning, Monday blue, is it? So I think it's possible if that is true, because probably that's true when you think about everything during Monday morning. So I have no answer because I never heard about that one. But as I mentioned earlier, sometimes stress itself, especially chronic stress, can actually increase risk of heart attack. Yeah. So don't admit the effect of your mental health.
Thank you, Dr. Ho. There's another question from the audience. Is borderline ST elevation something to be concerned of?
Okay. Borderline ST elevation. So you have to think about what context. Okay. If somebody, the important thing that we have to think about is that ECG is not perfect. Okay. Even during having chest pain, but the ECG is not showing much or showing very little, like a borderline, what you mentioned here, it doesn't preclude the possibility of a person having heart attack. Okay, so you still have to use your clinical judgment. If somebody is having high risk of getting heart attack and they presented with symptoms or having other signs that indicate that the heart is maybe being stressed already, even ECG doesn't show too much, you will still have to be very cautious and probably be admitted for further evaluation. Now, if you have this so-called borderline, I don't know how you define borderline as the elevation. It's in a person under normal circumstances, there is no otherwise healthy person, no risk, and not having any symptom at all, then probably it's nothing to be concerned about. That depends on what you mean by ST, borderline ST elevation. Okay, so it may not actually is something significant because it doesn't fulfill the criteria for a true ischemic changes, right?
Thank you, Dr. Ho.
Okay.
I actually have a question myself.
Sure.
This thing called statin-induced myopathy. So how do we actually manage this?
Manage this, okay. Depends on, yeah, this is a very good question. So we now know that statin can give you muscle pain and weakness, right? That's part of the side effect called myositis. However, like I mentioned earlier, just like not all oils are the same, right? Some oils are healthy, some are not. Same with the statins, right? Statins got different types of statins. Some are more water soluble, we call hydrophilic. Some are more fat soluble, lipophilic. So they will have slightly different properties. So in general, the one that is more fat soluble or lipophilic, they are the one that is more likely to cause that actually go into the peripheries, and then cause more chances of muscle inflammation and all that. So if the patient does have this side effect or more sensitive to statin side effect, then we probably want to switch to a more hydrophilic type of statin. Okay, so you need to manage it by, of course, the doctor will take blood and make sure that they are not having severe muscle breakdown and all that. They would probably take blood for creatine kinase and all that. But if the patient's condition is mild, then it's probably just switching the medication will do. Or bring down the dose and that sort of thing.
Thank you so much, Dr. Ho, for answering the question. I guess so far we don't have any more questions in the chat box. Once again, I'd like to thank you very much, Dr. Ho, for elucidating us on this. I'll be passing to Sydney to talk about the quiz session next.
Sure.
And so We'll be having a quiz to evaluate the viewers' knowledge session. You 10 minutes to join. The link will be sent in the chat box below.
So you will let me know what's the results, right?
After we are finished with the quiz, we'll be letting you know the results.
All right. So I can leave now.
Sorry, yeah, you can leave.
Okay.
Thank you so much.
Thank
Thank you very
Thank
much.
you. Thank you, everyone.
After you finish the quiz, after this 10 minutes, in the all QIU students, your CA point. And for QIU, thank you very much.